Check. Thank you so much for talking to me. Before the show, I spoke to Sir David Nicholson, who was Chief Executive of NHS England between 2006 and 2014. He's currently chair of 2 NHS trusts in the Midlands. And I started by asking him whether, like Keir Starmer, he thinks the NHS is in crisis.
I chair 2 organisations, 2 hospitals, and I was reflecting earlier that I started in 1978 in the NHS, and I've never seen the level of pressure that we have on the system that we have at the moment.
So crisis would be a reasonable word to use, do you think?
I think crisis would mean that it was completely out of control, which I don't think it is. I think there's lots of really fantastic work going on. But there's no doubt people can feel it. Yeah, the pressure, both the patients and the staff.
Well, I'm picking up on that very point. We've been talking to a nurse today, for instance, who says that she sometimes goes through a 12-hour shift without eating because she can't afford to pay for the food. And she had a 100-year-old waiting in A&E for 24 hours. When people hear these kind of stories, are you concerned that basic faith in the NHS is now dwindling in this country?
And these things do happen. I mean, I've heard similar stories both in Sandwell and West Birmingham hospitals and in Dudley. But I think what people can see is that the staff are really going above and beyond to deliver services for them. And we've been very careful at both hospitals to properly supervise and audit to make sure that people get life-saving treatment. Nevertheless, I think all of those stories do indicate to people that there is something that requires urgent action for the NHS for it to be able to sustain in the medium and long term.
Can I ask about how the NHS can be secured for the future, which is what everybody is now debating? You brought in very famous Nicholson reforms, which were efficiency savings. Do you think the lemon has been squeezed as much as it can be in that regard?
There's no doubt. As I say, I started in 1978, and people forgetting it was only in 1975 when the IMF insisted that the healthcare system in this country was cash limited. Before then, we basically got what we spent last year plus a bit. And so cash limiting has always been a key issue for the NHS. We've always been more ambitious than the resources that we've been made available. But I think it doesn't take a genius to work out that, up to 2010 on average, in real terms, the NHS grew by 4.8%. Over the last 12 years, it's grown considerably less than that. Even when some of our European partners have managed to grow their healthcare system at all as well. So there is undoubtedly an issue about money, but it's not the only issue that faces the NHS to be sustainable going forward.
So the government do have to find more money, presumably also for staff pay, because this is about retention, and an awful lot of people seem to be leaving the NHS. Can I ask you about some structural issues or proposals that we've had? Wes Streeting, the Shadow Health Secretary, has said that he would like to see a big new expansion of primary care centres, bringing in doctors and nurses and physios and all chemists into the same place, that was part of the original offer of the NHS in the 1940s, which has never really been followed through and would take a lot of the pressure off hospitals today.
Yeah, I mean, there are lots of ideas that people are bringing forward for the NHS, and they're all, I guess, welcomed by us because, we need to understand what people require. There is no doubt in anyone's mind, I don't think, that primary care needs both a significant injection of resources, but also reform. It needs to think more carefully about the scale and nature of the different professions involved in primary care. We need to think more carefully about the way in which patients are referred through primary care. We need to make sure that primary care has access to diagnostics and other services. In that way, I think we will improve the services for patients, because primary care plays a key part in any healthcare system. I've worked in 20 healthcare systems across the world, And most people would say to you, the quickest way to improve people's health and tackle health inequalities is investment in primary care.
So that's the start. And it's been suggested again by Wes Streeting, but also by others, that we should move to some kind of system of self-referral to consultants for a range of possible complaints. It seems to me that that might overburden consultants quite quickly, and that you do need a gatekeeper of some kind for the hospitals. But again, your view.
Well, I think what primary care does, it manages risk. It's really good at it. It sees lots and lots of patients and makes an assessment about how quickly they need secondary care or what other services that they need, but not everywhere. So I do think there is a case for direct referral for some services. In fact, we already do it in things like physiotherapy, but I think we could extend it to diagnostics and some secondary care. I think it is perfectly possible to do that, but you can't do it in one size fits all. You can't just say as a blanket that people should have access to secondary care, because you're absolutely right. Apart from anything else, we will be overwhelmed.
I was talking to Sir Andrew Dilnot on the show just yesterday, and he pointed out that when Jeremy Hunt was on the Health Select Committee, he was talking about the need for $7 billion a year going into the NHS, and yet at the moment it's just $250 million the government is putting in to get people out of beds faster, which seems, without being rude about it, chicken feed by comparison.
I think the problem that we're facing at the moment in the NHS is like, any kind of organisation, you need some sort of certainty and structure around what you do, because that you get the best outcomes by planning and organising your services properly. And what's been happening over the last few years is the total amount of money going to the NHS has undoubtedly gone up, but it's gone up in a fairly ad hoc sort of way. So, it's fantastic that the government have allocated another 200 million to help us get people out of hospitals, vitally needed. But if they'd have made that decision 18 months ago, we could have done a much better job of delivering services for our patients. So, my plea to politicians in these circumstances is to give the money out early and get people to plan so we can make the most of it.
We've talked about primary care. We've talked about unblocking beds. Another area where, again, on this show, we've talked an awful lot about is social care and the bigger issue of social care generally. Sir Andrew talked about the delays and the inability to implement his reforms as a tragedy. Do you think he's right?
Oh, I think so. I mean, everyone agrees. And, how many prime ministers now have said that they're going to fix social care over the last few years. I remember when I was the chief executive of the NHS, together with Andy Burnham, who was the Secretary of State at the time, he put together an idea of a national care service in order to create the environment where social care could thrive. That was defeated at the time. It didn't go forward. People have tried to do bits and pieces, but it needs wholesale reform based on Dilnot's proposals around the funding of it, which I think are very, very sensible and, will make a big difference, or could make a big difference to citizens. But there's still quite a lot that we can do working together with social care. It's a historic divide in the system between health and social care that was not solved in 1948. And there's lots that can be done, I think, between health and social care to improve services, even within the circumstances we find ourselves.
What about not self-referring but self-funding? There's been a discussion in Scotland in particular where people are saying things are so bad that actually those who can afford it should be paying for some kinds of operations, some kinds of diagnostics inside the NHS. For other people, that is crossing a line. It was always going to be a service free at the point of use. What's your view?
Yeah, that crosses a line for me on a number of levels. And the first thing that I would say, looking at healthcare systems across the world, if you end up with a healthcare system for the poor, you end up with a poor healthcare system. And that's shown anywhere that people have tried to do this. Secondly, getting money from people into healthcare, the most efficient and effective way is through general taxation. If you look around the world, you can see it's the least costly. We have very low administrative costs in this country to enable it to happen. And the third point I would make is that the real restriction on delivering services at the moment and recovering is staff. We simply don't have enough staff. And the private healthcare is predominantly staffed by NHS staff. So all you're doing in those circumstances then is kind of is moving the services around. So and the staff have only got a limited amount of time they can use. So you don't really get much benefit from it. There is no doubt in my mind that in the short term we could use the private sector more for NHS care. We could buy up the capacity in the private sector in order to treat more patients, because we have to get these waiting lists down. Because one of the things that you'll know better than I do historically is that the continuing sustainability of NHS depends on people in this country being prepared to pay their general taxes in order to make it happen. And if they feel that doesn't happen, or they can't do it in that way, then we've got a really serious problem.
Sir David, I know that you don't want to wade into the pay dispute and you don't feel that's your role, but as the guy who was at the top of the system for so long, what is your personal feeling about the nurses and ambulance staff and others who are on strike at the moment? Because we're hearing some terrible stories.
Well, the first thing I would say is that we've got lots of vacancies. And looking forward, the critical thing for the NHS and healthcare generally, and this is not just in this country but around the world, is making it an attractive place to people to come and work. And there's lots we need to do to make that better. Some of our employment practices are not very good. We have to change the way we think about the way we support our employees, the way we train and educate them. So there's a lot of work to do with our workforce in order to make them happier with the way in which they work in the NHS. Pay is clearly a part of it. And, you don't need to be a genius to work out. If you look at the graphs, how public sector pay, and in particular healthcare pay, has drifted down over the last 12 or 13 years. And the last time we had to try and reconstruct the NHS, which was sort of 1997 to 2000, we started off thinking about pay. And what we need is a proper pay strategy. We're in a bit of a hole at the moment, aren't we, in terms of the pay negotiations and all the rest of it. And as someone said today, the government can't win it, but they can stop it. And so I think the government need to do what they're there to do, which is to stop it, to solve the problem. But we need a proper pay policy. If you think about, pay in the NHS, it's gone behind, and we need to attract these people going forward. But at the other end, in terms of low pay, particularly in social care, we've got people, doing really important care work on £10 an hour. Now, that's not going to be, and we have problems in the Black Country because Amazon opened up one of their depots, and suddenly a whole load of our people went off to work for Amazon. So we need and we recognise it's not going to be solved overnight. This is not a solution that can, but we need a proper strategy over the next few years to get pay in the right place.
So to sum it up, the message would be to ministers, get round the table and put something on the table which stops this as soon as possible. It will happen. If we think we're going to beat down our staff through attrition, then it's going to create even more problems for us going forward in terms of recruiting staff and keeping them and all the other things that I've said before. It needs a solution. Sir David, a very passionate message. Thank you very much indeed for joining me. Coming